Okay, let's dive in. Are you feeling just constantly drained? Maybe your body aches, but there's no obvious reason, and your head feels, well, foggy.
Yeah, that persistent fog. It's more than just being tired.
Exactly. A lot of people feel this way, this kind of extreme fatigue and pain. But what if these are actually clues? Clues pointing towards two different issues that often get mixed up: vitamin D deficiency and iron deficiency or anemia.
That's right. And today, that's what we're untangling in this deep dive. We're looking at these common reasons for low energy, that sort of generalized pain, the mental fogginess.
We've dug into the research to help you make sense of what your body might be telling you, hopefully getting you beyond just a vague diagnosis.
Yeah, because these symptoms, they can really, really drag down your quality of life. I mean, feeling utterly exhausted all the time. It's debilitating.
It really is. Our goal here is to give you the knowledge, or sort of a shortcut maybe, to understand your own system better.
Absolutely. To be better informed.
So let's start with those symptoms they share. That profound fatigue we mentioned, the deep tiredness.
The kind that sleep doesn't seem to fix.
Right. And the generalized body aches, not agony maybe, but just persistent, nagging aches.
And the sleep issues, too. Waking up multiple times, that interrupted sleep pattern.
Oh, and the cognitive stuff, that brain fog, maybe feeling confused, forgetting things, or even just struggling to understand something new. It all adds up.
It really does. And what's so interesting, or maybe frustrating, is how these similar symptoms lead to this common diagnostic confusion.
Yeah, people and sometimes even doctors struggle to tell vitamin D deficiency apart from anemia, the iron issue.
Definitely. And look, we always take a holistic and integrative view of health, but knowing the distinctions here is still super important. It helps target what needs fixing.
Okay, that makes total sense. So if the symptoms are so widespread and overlapping, how do we actually start to figure out which it might be? What about tests? Blood tests?
Yeah, absolutely. For clear diagnosis, you really need a specific blood test, an analytica sanguinea, as it's sometimes called. And for the iron part, it's really not enough to just get a basic iron level check. You need what's called a full iron profile, or Purcell Ceteremico.
A full profile. So what does that include?
Well, it includes ferritin, that tells you about your iron stores.
Hmm.
Then there's the circulating iron, which is, what's available right now.
Okay.
And also the body's capacity to transport iron. Plus, you need to check for associated cofactors.
Cofactors, like helper nutrients.
Exactly. Things like vitamin C, maybe some B vitamins, that your body needs to actually absorb and use the iron properly. And, critically, you check the vitamin D levels in the same blood draw.
Right. Get both pictures at once. Now, for vitamin D, the research we looked at had a really interesting point. It's not just about the number on the test result, is it?
No, not at all.
Mhm.
And this is key. Vitamin D acts more like a prohormone in the body than just a simple vitamin.
Pro-hormone, meaning?
Meaning your body has to be able to convert it and use it correctly. Just taking a vitamin D supplement might not be enough if your body can't do that conversion step properly. You won't get the benefit.
Ah, I see. So you could be taking it, but it's not actually doing the job.
Precisely. There might be an underlying issue blocking its utilization.
Okay, so this is where it gets really interesting, I think. If the symptoms look so alike and the blood tests give us clues, what's the main difference? The material we reviewed suggests it often comes down to whether you feel more fatigue or more pain. Let's unpack that. Maybe start with anemia, the iron deficiency.
Right. So with anemia, the dominant feature tends to be an energy deficit. It's often really noticeable, especially, say, mid-afternoon, around 5 or 6 p.m.
That classic afternoon slump, but maybe much worse.
Much worse. We sometimes call it the sofa and blanket syndrome. You just have this overwhelming urge to lie down. You might feel irritable, want to be left alone, just completely drained.
Sofa and blanket syndrome, I think I know that feeling. It's like your body is forcing you into power-saving mode.
That's a perfect analogy. It really is like your phone on low battery, just doing the bare minimum. People with significant anemia might genuinely fall asleep almost anywhere. Mid-conversation, even during treatment sometimes, their energy is just depleted.
Wow. Okay, so that's the energy crash side with anemia. What about vitamin D deficiency then? How does that usually show up?
With vitamin D, it's often more closely linked to poor pain management. Pain signals can get amplified, or pain becomes chronic because the body isn't interpreting those signals correctly. It struggles to create a a healthy pain response.
And that connects to vitamin D's role in bone health, doesn't it?
Absolutely. It's crucial for bones and joints. It works
Mhm.
together with vitamin K2 to make sure calcium and other minerals actually get into the bones properly.
Right, preventing things like arthrosis, osteoporosis.
Osteopenia, yeah.
Yeah.
All those conditions related to bone density and joint health. And honestly, that's just scratching the surface. The research mentions vitamin D having over 300 known functions. And some newer studies are suggesting it could be over 1,000. So it's doing a huge amount in the body.
Clearly fundamental. Okay, so beyond fatigue versus pain, are there other, maybe less obvious clues or underlying factors we should know about?
Yes, there are. One really telling sign, specifically for iron deficiency, is something called pica.
Pica. What's that?
It's this strong compulsion to eat or chew things that aren't food and have no nutritional value.
Like, what sort of things?
The most common one is actually ice, craving and chewing ice. But it can also be paper, cardboard, even dirt or grass in some cases.
Really? Dirt. Why would someone do that?
It seems to provide some kind of strange relief or satiety. With ice, there might also be a bit of an analgesic, a pain-numbing effect in the mouth.
Huh.
But the key thing is, this isn't just a weird habit, especially if you see it in kids, but in adults too. It shouldn't be dismissed. It can signal a really significant pathological level of anemia. It's a major red flag.
Good to know. That's definitely not something to ignore. What else? The research mentions stress.
hmm Accumulated stress from work, relationships, life in general, it's a massive energy drain. We're not just talking feeling stress. Chronic stress impacts your hormones, your adrenal glands.
Right. It makes you feel physically exhausted.
Exactly. And it can also amplify pain signals or make existing pain sort of chronic, making it just stick around indefinitely.
And then there's the gut connection, right? That came up quite a bit.
Hugely important. If you have what's called high intestinal permeability, sometimes people call it leaky gut, it can seriously impair your ability to absorb both iron and vitamin D.
So even if you're eating iron-rich foods or taking supplements, it might not be getting in.
Precisely. And it's not just the intestines. Problems in the stomach, like gastritis, reflux, heartburn, those can specifically hinder vitamin D absorption.
Why the stomach for vitamin D?
Because vitamin D needs quite a few gastric cofactors, things present in the stomach environment, to then be properly absorbed further down in the duodenum, the first part of the small intestine.
Okay, so gut health is critical for both.
Absolutely. And there's one more specific blood test finding that's really important to mention. Sounds a bit odd. High ferritin, but low circulating iron.
Wait, high stores but low available iron. How does that work?
It seems counterintuitive, right? But it's a really significant pattern. If your ferritin, your iron storage, is high, or maybe even in the normal range, but the iron actually circulating in your blood is low, this often signals an underlying infection. Could be viral, could be bacterial.
An infection. Why would that affect iron levels like that?
Well, the body is clever. It knows that many pathogens need iron to thrive. So as a defense mechanism, the body sometimes intentionally locks away the iron in storage, raises ferritin to essentially try and starve the bug out. It cuts off its supply.
Wow, the body is literally hiding the iron from the invaders.
Kind of, yeah. It's particularly common to see this pattern in women, interestingly. And what it means is the solution isn't just throwing more iron at the problem. You need to find and deal with that underlying pathogen first.
That's fascinating and probably something easily missed if you're just looking at, say, hemoglobin or basic iron.
It can definitely be missed if the doctor isn't looking at that full iron panel and considering the whole picture. The context really highlights why that comprehensive testing is valuable.
Okay, this is all incredibly helpful for understanding the potential issues. So let's pivot to action. What can people do to optimize their levels, starting with vitamin D?
Well, the most natural way is still sun exposure. The research suggests letting your skin get slightly pink, definitely not red or burnt, without sunscreen, exposing as much skin surface area as practical.
Sensible sun exposure then, but if you need to supplement orally,
Remember the potential stomach issues we mentioned. If your digestion isn't great, absorption might be poor, since vitamin D is fat-soluble.
so take it with fat.
Exactly. Taking it with a little water and maybe a dash of good quality olive oil can really help improve absorption. Helps the body actually use it.
Good tip. Okay, and what about iron for anemia? Supplements can be kind of rough on the stomach, can't they?
They really can be. Standard iron supplements often have pretty low digestive tolerance. The cells in your gut lining get saturated quickly, they can't absorb it all, and a lot just gets, well, expelled. That's why it often causes dark stools and digestive upset.
Right. So are there better options?
Yes, the research points towards liposomal iron as being a superior option.
Liposomal.
Yeah, it's basically iron encapsulated in tiny fat bubbles, liposomes. This structure seems to allow for significantly better absorption, and it's usually much gentler on the gut. Ferrous sulfate is another common form, often prescribed, but the liposomal form is often highlighted for that better absorption and tolerance.
Liposomal iron. Okay, worth remembering.
Definitely something to discuss with a healthcare provider if you need supplementation.
So, wrapping this all up, what's the big takeaway for someone listening?
I think it's understanding that these subtle yet distinct differences between vitamin D issues and iron issues give you really powerful insights. If you're dealing with that crushing fatigue, the brain fog, the chronic pain,
Yeah, it shows they aren't just random, isolated problems. They're interconnected signals your body is sending. And often they need specific targeted support, not just, a generic multivitamin.
precisely. And maybe it prompts a deeper question for you, listening. How much clearer could things become if you really paid attention to these specific cues from your body?
And how could that understanding help you work maybe more effectively with an integrative health professional, someone who can help you find the actual root cause?
Exactly. Keep observing yourself, keep learning, and don't be afraid to ask those deeper questions about your health. It's your body, after all.